I am going to be joined today by Ginny.
Hi.
Hi, Ginny.
Hello. How are you?
I'm good. I'm good. Welcome to Maven's Instagram Live. By way of introduction, I'm Dr. Jane Van Dis. I'm a practicing OB-GYN and Maven's medical director. And I'm joined today by Ginny, is it Bowers?
Yes.
Ginny
Yes.
Bowers, who's a certified nurse midwife as well as a certified lactation consultant,
Hmm.
right?
Yep.
Am I missing other
No,
certifications?
that's it.
Okay,
Yes.
great, great. Do you do you find that a lot of midwives also have the, is it IBLCC?
IBCLC. I would say a fair number, but it's certainly not a requirement, but it complements midwifery so well. So
Yeah,
yes, I do see a lot of midwives eventually going there. Hmm.
wonderful, wonderful. So feel free to those who are watching or listening to drop any questions that you have in the chat. We'll try to get to them. Otherwise, let's just start out, Jenny, by getting to know you. Tell us a little bit about how your journey to midwifery came about and what inspired you.
Sure. So I've always had a lifelong passion for healthcare in general. I started off wanting to be a veterinarian, as a
Yeah.
child, of course. I eventually switched to human medicine, and I really liked the nursing model of care with a patient-centered focus.
Mm.
And when I was going through my RN training, I knew I wanted to eventually be a nurse practitioner, and I actually became pregnant and had my first child while I was doing RN school. And that experience actually is what led me towards midwifery. So, it's been quite the journey, but I love it. And it's just every day is so exciting. So I'm very
Wait,
fortunate.
so I have to ask, was it a good experience or was it a challenging one?
It was actually pretty challenging.
Okay, okay.
Yeah, I actually didn't really know what a midwife was until I had my first child. And, I took that experience and kind of explored and then learned about midwifery after the fact. Hmm.
Okay, okay. Um, I guess I feel like maybe not everyone that is watching or listening knows what a midwife does. So take us through the steps of education, like what's required, and then
Sure.
tell us a little bit about what midwives do, and then obviously focus on what you do.
Sure. So there's actually different types of midwives. So I'll speak to mine, which is a certified nurse midwife. So I have my bachelor's as a registered nurse, and then I've gone on to get advanced training. You can actually be a master's prepared or a doctorate prepared midwife. As far as our scope, so what we do, the easiest way to really explain it is to think of a women's health nurse practitioner and then add the labor and birth experience. And we also are primary care providers for newborns for the first 3 months of life. So it's a very well rounded, all encompassing role. And as a midwife, I don't only provide care for women who are pregnant, it's actually throughout the entire lifespan. So from teenage years up through menopause and everything in between. Hmm.
And do you find that do a lot of people or only a small fraction of people come to midwifery through a nurse practitioner degree?
I feel, well, in the United States, so midwives are worldwide, right? So in the United States, the majority of midwives are certified nurse midwives, but there's a very large group of professional midwives as well that do not have that nursing background. Hmm.
Okay. Yeah, so just for clarity, because I do think there is confusion, can you tell us about the other types of midwives here in the US that someone might come across and what their training looks like and how it compares to yours?
Sure. So I can't speak to it, in explicit detail just because it's not my personal experience, but professional midwives, they don't have that medical background. They are very skilled at providing home birth services. They are not able to facilitate labor and delivery at a hospital setting. So that's one of the big differences. So as a certified nurse midwife, I can attend births at a hospital, home, or birthing center. I'm also able to prescribe medication. So that's something that professional midwives are not able to do just because, again, they don't have that medical background. But certified professional midwives are amazing in their own right. It's just a slightly different model of care. Mm-hmm.
Sure. And when someone refers to a lay midwife, what is that?
So a lay midwife, if they're speaking of a lay midwife, they're really referring to a professional midwife. So they are professional midwives in their own right. They're just a different type of midwife. They're
And then,
licensed, certified. Mm-hmm.
oh, okay. And then do different states have different certifications or different rules regarding midwifery?
There are. Every state has its own unique rules, restrictions, and practice. The certifying body, so as a CNM, I'm certified nationally. Professional midwives can also have that same type of certification. And then there's other midwives that may not have that certification, but it's just a different type of midwife. So they are not in every state. Whereas
I see.
the CPMs and the CNMs, which is myself, were in every location.
Every state. And if someone is thinking about choosing a midwife and they're confused about the credentials, how would they go about trying to understand? Is there a website to look up midwives at?
Sure. So ACNM, which is my certifying body, they have a website that really kind of breaks down the different types of midwives. That's
Oh,
a
great.
great resource. Mm-hmm. And then there's MANA for the professional midwives. You can go there as well. So that would be a really good starting point. MANA. Mm-hmm.
MANA.org.
I believe so. Yes.
Okay. I just know that the public gets really confused about the term midwife.
Yeah.
And it's really important. It's an important decision, and I feel like our listeners and our members should absolutely have all the information they need to make the decision that's right for them.
Sure.
So that's why I wanted to ask you that. Okay. So moving forward, what are some of the benefits of having a midwife on your care team?
So we are, our expertise is shared decision making, patient advocacy. So, even if you have a more high risk situation, we work very closely with OB-GYNs, maternal fetal medicine specialists to still provide that midwifery model. And oftentimes in my practice, I still am the primary person attending the birth. So you still get that benefit of having the midwife at your actual birthing experience.
Yeah. Do you see a lot of practices where a hospital will have midwives available as well as OB-GYNs, that kind of integrated model?
Yes, I do. I feel like actually the majority of the hospitals, if they have midwives, they're going to also have the OB-GYN there as well. And depending on how acute the situation is, you may have just the midwife at that bedside, or you might have the team. It kind of depends. Mm-hmm.
Yeah. And is it common sometimes for women to start out with OB-GYN care, move over to midwife, or vice versa?
I'd say it goes both ways. There's the perfect provider for each person. So, depending on preferences, I have some people that go from one side to the other, or they go back and forth. My practice here, oftentimes the woman will go throughout different providers just to get the different experiences.
Right. To try, yeah. So one of our fabulous regulars, Bree Powell, she asks, do you visit your patients at home postpartum?
So in my practice setting, I actually do not, but I could absolutely, as a midwife.
Yeah. Well, Bree has a follow-up question. Do you do more telehealth visits now due to COVID?
We did. I would say now we're starting to have more people that prefer to come into the office setting, but certainly in the beginning of the pandemic, we had a very large amount of telehealth visits.
Yeah. Do you feel like hospitals that have midwives on staff are also more likely to be hospitals that offer trial of labor after cesarean? Do those two things go hand in hand?
I'd say they do. It's not exclusive, but certainly that would follow the midwifery model. So yes, I would say most likely they would have that service available.
Yeah. And is that something you offer as well?
So it's something that we're working on with this hospital setting. Yeah, it's in the works. So hopefully soon.
Do you mean that they don't currently offer VBAC, or they don't allow midwives to offer VBAC?
It's the VBAC aspect. So they're
Yeah.
getting all of the, necessaries in place, and then we'll be able to offer that service. But
Oh,
yeah.
that's so good. Yeah.
Hmm.
Bree asks, what are your most frequently asked questions from patients?
So the biggest one is, what is a midwife? So I get that a lot. I also have patients ask if I can prescribe medicine. So if they're pregnant, they often want to know if they can get an epidural. Absolutely. There's no restriction on that with when I take care of you. So that's a big one. And then if I can attend births elsewhere. So in my setting where I am now, I only attend births at a hospital. But again, I could attend birth at a home birth or a birthing center if, I was in a different environment. Hmm.
Yeah.
Those are the big
Great,
ones, though.
great question, Bree. Great question.
Yeah.
Um, do you feel like, or I guess data shows us that women who are under midwifery care are less likely to be recommended a cesarean, and that's obviously really important for the women who are birthing as well as us as a nation, right? Our
Hmm.
C-section rate is too high. I think everyone agrees with that.
Right.
Without, disparaging doctors, which I know you won't do, but
No.
what do you think is the difference? What accounts for the difference in cesarean section rates?
I think a lot of it is our practice model. So we try to only initiate an intervention if needed. So we tend to do some very close, watchful waiting and just monitor things and be patient. So we allow the
Yeah,
body the time that it might need to kind of progress naturally. We'll make an intervention if indicated for sure, but I think a lot of it is just patience.
yeah.
Yeah.
Well, and is it true? I feel like in my experience, it's true that midwives are oftentimes at the bedside for a greater amount of time
Yes.
than the physicians are.
Absolutely, yes. Oftentimes, and certainly in my practice, when we are at the hospital, we're only at the hospital. We don't have to worry about sharing office
I
responsibilities. So
know,
that
right?
is huge, being able to be at
Yeah.
that bedside. Hmm.
Well, I'm an OB hospitalist, so that's my job too. And
Sure.
I work at two hospitals now, and one does not have midwives, and the other does. And I obviously I love working with midwives. I think it's a great it's just great teamwork, right? And to be able to give patients, number one, the choice,
Right.
right? Because I feel like if someone feels more comfortable with a midwife, thank goodness midwives are there. If
Yeah,
someone feels more comfortable with a doctor, thank goodness I'm there.
sure.
And obviously, if there are complex medical
Mhm.
conditions, I'm sure you're like, thank gosh, Jane's
Right.
there.
For sure.
But yeah, having choices in birth, I think is so essential. Um, what I mean, I feel like there's such like a range of hospital support for moms, with some hospitals offering, uh, the hospital will help provide a doula, the hospital will have
Hmm.
the ability for water births, the
Hmm.
hospital will really have a focus on how best to support women in labor. Um, I guess, what do you see are some of the biggest challenges for hospitals implementing some of those labor-friendly practices?
Well, I think a lot of it is that it's really hard to make changes in healthcare in general. So, you have a lot of, it's just always been done this way. So you have to
Right.
kind of deal with that. Um, and, depending on the intervention, sometimes it can be kind of cost prohibitive to bring in additional equipment, such as labor tubs or of that nature.
Yeah.
Um,
Remodeling.
yeah. Yeah. So I think it's just the trying to get through the red tape, so to speak. But that is one of the benefits of midwives, is that we're always trying to think of ways to kind of change it up and improve the birthing experience. So having that type of provider that's kind of guiding with that is so helpful with improving, labor and delivery in the hospital setting.
Yeah. Do you feel like uh, hospitals should partner with birthing centers Bree asks, what is a birthing center and how do they differ from hospitals?
Sure. So there are different types of birthing centers. There's actually a birthing center nearby that is partnered with a hospital, which is so lovely. But there's also freestanding birthing centers. And so what that is, it's kind of in between a home and a hospital setting. So you get that home birth type of environment, but you're not physically at home. So if you were, say, too far away from a hospital where it would be safe to have a home birth, you might go to a birthing center that's usually within 15 minutes. You get to be in a comfortable bedroom-like environment, but they don't have medication. So you can't give pain medicine. You wouldn't be able to do, an epidural or anything like that for sure. But you're going to still get that homey experience without necessarily having to open your actual house up to that.
Right.
Mm-hmm.
So we saw over the weekend, the American College of OB-GYN had its annual clinical meeting. And I don't know if you saw it, but there was a paper that was presented, and it showed that actually infants were most at risk in the birthing center location for the birth, with the study showing that infants were 8 times more likely to die in the birthing center. What can we do to either make birthing centers safer for babies, or how do we improve that statistic?
Sure. So I have heard of that paper. I haven't had a chance to look at it explicitly, but I am curious to know of the centers how many of them were actually certified, because you don't have to be a certified birthing center, so that could be the biggest factor for sure. And then safe staffing. Certainly you would want to ensure that you have the provider, but as well as a good registered nurse there alongside during that birth. So I'd have to look at it and see what each center had with their setup.
Right, what their certification was. Well, and then someone commented to me over the weekend as well that there used to be a birthing center associated with, is it Mount Sinai in New York City, but then it disappeared. I wonder if it's hard for hospitals to financially partner with birthing centers, because that would be the ideal, right? So that the transfer was seamless if there needed to be a transfer, either for mom or baby.
Right. It could be that. I think a lot of it is that most birthing centers they might only provide prenatal services. So to run a birthing center, I think you also would need to provide more GYN primary care type of services as well. So I feel like that was probably a key factor. And then different states have different restrictions as far as having an OB-GYN also involved. So it could be that was part of it as well, staffing.
Yeah. I get transfers from a birthing center here in Los Angeles, and they don't have an official partnership with the hospital that I work at. But usually, so long as, and you probably feel this as well, so long as we can get records for the patient, whether the patient has them in her hand or whether the center transfers them, that's a real key component of keeping patients safe, in my humble opinion.
Sure.
Okay. I think you mentioned other services that midwives provide outside of labor and delivery. Do certified nurse midwives consider themselves almost like a family medicine doctor, like a primary care provider?
Certainly. I am a primary care provider for women, so pretty much everything that you can think of, I will at least be the starting point, and then we would refer out if need be.
Yeah. So does that mean that then you do a little bit of pediatrics as well?
So in my setting, I actually don't need to, because we have the pediatricians here. But if I were at a birthing center or home birth, then yes, I would provide that initial pediatric care too.
Oh, wow. Okay. And then how would you recommend someone go about finding a midwife? I feel like we talked about this a little bit, but are there other channels other than we talked about the ACNM,
ACNM.
ACNM,
Yep.
sorry. ACNM, and then the
MANA.
MANA. Yeah. What are some of the other ways that people find midwives?
So the easiest way is probably just a quick Google search, midwives near me. So that would be a simple way. You could also reach out to local women's GYN clinics and see if they employ midwives. Maven has midwives, of course. So yeah, we're pretty much everywhere, right?
No, it's true. It's true.
Yeah.
So, speaking of Maven, let's talk a little bit about the types of appointments that you have. What would you say are the top three appointments that you have on Maven?
My, I think my highest, I do a lot of birth planning type of appointments. So a lot
Mm.
of pregnancy, prenatal type care, and then a lot of, you know, contraception management. Those are the primaries. I have some general just UTI questions, things like that. So just general GYN things, but birth control and prenatal care is what I focus on.
Yeah. Well, we at Maven are actually going to be putting together. We obviously, you mentioned that people come to you to help understand or put together or formulate a birth plan.
hmm
And we're going to be launching a postpartum plan.
So
So we
awesome.
want to give moms the ability to think about what postpartum needs they have, what goals they have for feeding their infant, and then being able to think about who's going to help support them in the home after they give birth, and does any of that preparation, need to happen before birth? Because what we find, right, is that moms get home
Yeah,
and they feel like suddenly like the floor dropped out, and all the
right,
providers who were there during their birth are not necessarily around in the postpartum period.
right. Yeah, no, that sounds amazing. That sounds wonderful.
Yeah, yeah. Well, Allison Stubbe, who's a fantastic professor at University of North Carolina, she published in October in the American College or the Journal of Obstetrics and Gynecology, and she kind of outlined like all of the ways that we really, really, really need to improve postpartum care, right?
Sure, for sure.
Yeah. Um, okay. Bree asked, what types of appointments do midwives on Maven do? But I feel like you pretty much answered that. Um, do you how many days a week would you say are you on Maven if people want to come find you?
I'm usually at least two, it might get up to 4 days. So 2 to 4 days a week.
Oh wow. Oh, that's
Yeah.
fantastic.
Mhm.
That's fantastic. And do you ever have virtual appointments with Maven members while they are on labor and delivery, or they want
I've not
advice while
yet. I've not yet. I have had messages actually get sent to me. So I've communicated through Maven
Oh
text, but
great.
not live.
Where they're like, should I do the epidural? What
Yeah.
types of questions do they ask during labor?
hmm
Is it mostly about pain meds?
I've had, should I go to the hospital? What kind of
Okay,
pain
yeah.
medicine should I get? Yeah. Yeah.
Yeah. Yeah. Um, what are some of the myths about midwives that you'd like to dispel here?
Myths, let's see. So the biggest myth I think I talked about earlier, as far as, a lot of people assume that we only provide care during pregnancy and labor and birth. So all of women's health. And the other one was if I could actually attend births at a hospital. Those are the primary questions that I get for sure. And like I said, pretty everywhere, home, birthing center, wherever you need to have a baby, we can be there. But those are the biggest ones. And then again, what is a midwife? That's another one. But pain medicine, that's another big question. I think those are the top three. Of course, I can prescribe for everything too.
Yeah. Um, do you feel that midwives are have a special gift in helping to rotate babies who might be coming down the birth canal facing up instead of facing down?
Sure. I think, I certainly have taken additional training in ways that we can kind of encourage the optimal fetal position for sure. And I think, it is something that was addressed in my program, but the main takeaway is that what we talked about earlier is having the midwife there, like yourself, we're there at the bedside for so long, we can recognize when something might need to be adjusted. So we can kind of initiate that change in the fetal position, before it becomes a problem. But yeah, it's something that we addressed, and we often will take additional training in that as well.
Yeah. Do you find more first-time moms or more moms who've already have a baby elect for midwifery care, or is it equal?
I I'd say it's fairly equal. Yeah, I'd say it's fairly equal for sure.
Okay, great.
Hmm.
Um, let's see. If someone has a high-risk pregnancy but wants to work with a midwife,
Yeah.
what are her options?
Like I said, we work as a team. So oftentimes in my practice, I usually alternate. So I'll have somebody see me for a visit, and then they might see the OB-GYN, or they might see the MFM provider, and we just kind of all share in the or in the care. And then at the birth itself, it's usually just myself. So yeah, we function very well as part of the team.
A high-risk team, yeah.
Hmm.
Now, do you help to first assist the surgeon in a C-section, or is
I
that do
do.
you? Oh, you do. Okay.
I
Do
do.
you enjoy that?
I do. Yeah, I like all of it. It's all
Right.
very
It's all
interesting.
birth.
I really love being able to go into the operating room with the family as well. It's hard having to step back, and
Oh,
being able to be
yeah.
there and be supportive is so wonderful. Hmm.
Yeah, no, that's totally true. I mean, if for whatever reason a mom needs a cesarean, it's nice for her to hear your voice if you've
Right.
been there throughout the whole labor than have like, a crew of strangers. They can be the best strangers in the world, but they're still
Right.
strangers.
Right. Absolutely. Yeah.
Yeah. What would you say if someone was listening and they wanted to think about a midwifery career? What are some of the first steps that young men or women,
Mhm.
or sorry, young women or men, might choose to investigate to see if this might be a great career for them?
Sure. So I would first kind of research the different types of midwives and see which model spoke to you personally. And then you would just kind of go off from there. So if you wanted to be a certified nurse midwife like myself, it is required to have the bachelor RN degree. So that would be the first step. Hmm.
But can people go into a certified nurse midwife program if they have a bachelor in something else, but then they maybe do a little bit of extra prep training, or how does that work?
There used to be some programs that provided that. It was just a little bit longer of a program, but I don't
Yeah.
know if any are still in existence.
Oh,
There might be a few, but most of them now are requiring the actual RN, and then some years experience before going into the CNM.
sure.
Hmm.
And then, uh, oh, what was my question? Oh, I'm blanking. I had this question, and then my phone said low battery, and then I forgot my
Oh
question.
no.
Um, well, I guess, do you have any other topics that you wanted to discuss that I didn't ask you about today?
I think we covered so much. I think the main reason that I wanted to do this talk was to really explain, what a midwife was, and that we're here to support you throughout your entire lifespan. So it's something that I am very passionate about. And I love being able to provide this service. So yeah, if you have any questions, feel free to find me on Maven, and we can speak privately as well, for sure.
Absolutely, absolutely. We value our midwives on Maven so much, and today is the International Day of the Midwife, right? So celebrating midwives around the world. They have different types of responsibilities,
Hmm.
but for the most part, all of them are caring for moms and families, and to your point, women of all ages. So
Hmm.
something to really be celebrated. Well, great. Well, thank you for joining us here today. And Bree, thank you as always for your great questions. We love the engagement. And next week, we'll be joined by Dr. Brian Levine. He is going to be back from his paternity leave. So next week, we'll be answering fertility questions. So it'll be nice to get back in that groove. Brian's been gone for a couple months now. So
Great.
All right. Well, have a great Wednesday, everyone, and we'll see you next week. Bye.
Yes, thank you. Bye.